Today is World Heart Day 2021. Every year in the month of September, we celebrate World Heart Day. I am sure you are all aware the burden of heart disease is ever growing, both on the country and across the world. So, if you look at heart disease as such, the biggest problem we deal on a day-to-day basis is heart attack. Heart attack is something that's a life-threatening emergency where people are expected to get to the hospital as quickly as possible and get the best treatment available across the world. We at Sri Ramakrishna Hospital have the expertise and have been doing these services for a very, very long time. Treatment with angioplasty and stent deployment for heart attack patients is done 24/7, 365 days in our hospital. So apart from that, we have varied services that encompasses both adult and pediatric population. In addition, we also have electrophysiological services for pulse-related or rhythm-related disturbances. I must emphasize the kind of infrastructure we have at Sri Ramakrishna Hospital. We have 3 cath labs, all of them being state-of-the-art, through which we are able to offer both adult and pediatric interventions and also electrophysiological procedures. And looking at our numbers that we have done in the last 2 decades, I think the numbers are ever growing. The quality of care and the number of complex procedures we are able to offer to our patients is worth mentioning. Of late, we have increased the kind of complex procedures that we are able to offer to our patients in the form of non-surgical intervention for aortic valve replacement, which has been initiated in the last few years, and we are able to treat patients without surgery for such conditions. In addition, we also have been backed up by our cardiothoracic surgeons who help us treat complex procedures. I also need to mention at this stage that we are a hospital that is more than 4 decades old. Sri Ramakrishna Hospital is part of SNR Sons Charitable Trust, so we actually treat patients across all socioeconomic groups. I take pride in sharing that we are the hospital who have consecutively in the last 7 years have been awarded a special certification for doing the highest number of cases under the TN Chief Minister's Health Insurance Scheme. In addition, we also have facilities for patients who come from various parts of the world. We have infrastructure both in terms of hospitality, catering, and various departments that we need to help our heart patients. Today for us is an auspicious day. World Heart Day marks an important landmark and holds a very special place in our hearts. The theme for this year is Use Your Heart to Connect. That simply means you need to try and help your friends, family, connect through them through various digital media, through various interactions, create awareness amongst yourself. Prevention is the best form of cure in any disease. The same holds good for heart disease. So today, as a cardiologist, I represent a large team of cardiologists who work in this hospital and been offering all the care and services. Please do share your thoughts. Please do express your difficulties to your friends, family. Come and seek the help of the doctors if the need arises. Do not hesitate to get treated. Please do remember there are risk factors that are ever growing like diabetes, hypertension, cholesterol, smoking, poor sleep habits, stress. All of this adds to heart burden. So we are here to help you. We at Sri Ramakrishna Hospital wish you the very best of health, and we continue to promise the best of care for all of you. Thank you.